Hey everyone, this is Maddie, and my special population is U.S. veterans suffering from PTSD. Have you ever wondered how veterans receive access to mental health services through the Department of Veterans Affairs? Throughout this presentation, I'm going to discuss the challenges our nation's veterans face with access to healthcare, specifically those with post-traumatic stress disorder, one of the top mental health disorders veterans suffer from. When you think of a military veteran with disabilities, you probably think of physical disabilities, such as traumatic limb amputation. However, many veterans suffer from wounds that we can't actually see. Here's some quick math for you. The Counseling and Wellness Center here at the University of Florida has 30 to 40 counselors that are required to provide care for all 55,000 students, plus faculty and staff. And this is on one college campus in one state out of 50 in the United States. Next, think about this. There are 18.2 million veterans in the U.S., according to our most recent census. Out of those, about half are currently using the services provided by the VA, and about 1.7 million specifically required mental health services last year. Although they do not provide a current patient-to-provider ratio, the VA hired 1,045 new mental health professionals in the past year. Unfortunately, it's difficult to keep up with the rising number of veterans that require these mental health services. In class, we spoke about the characteristics of vulnerability and what things make specific populations vulnerable to experiencing poor health. In this case, a veteran's predisposing characteristic is their occupation. Having been active duty and having a stressful career can definitely make someone vulnerable to poor mental and physical health. An enabling characteristic would be lack of access to care, due to a shortage of mental health clinicians or distance from a VA facility. Finally, the need characteristic in this specific case is mental health due to PTSD. There are actually a number of characteristics that make veterans more vulnerable to PTSD. Younger age at the time of the trauma, racial minority status, lower socioeconomic status, lower military rank, lower education, higher number of deployments, longer deployments, prior psychological problems, and lack of social support from family, friends, and community have all been shown to increase a veteran's overall predisposal to PTSD. Post-traumatic stress disorder is very common among combat veterans due to their experiences during wartime. As of December 2014, 57.2% of veterans receiving healthcare with the VA received a mental health diagnosis, with the most common condition being PTSD at 55%. To combat this, mental health services have been integrated in primary care settings throughout the Veterans Health Administration. Primary care mental health integration allows individuals with mental health concerns to be promptly assessed and treated during routine visits with their primary care physician, either directly or by co-located mental health clinicians. This results in improved detection of mental health conditions and improved treatment outcomes. Military veterans face unique barriers to accessing adequate treatment. Barriers include the requirement that they have either an honorable or general discharge to access VA medical benefits, long waiting lists at VA medical centers, and the social stigma associated with mental illness within military communities. Interestingly, but not surprisingly, mental health specialists tend to concentrate in larger urban areas, and even in those areas, there are disparities in the per capita number of psychiatrists. Some rural areas have none. According to the VA Office of Rural Health, veterans from these areas are less likely than urban veterans to access mental health services, in part because of the greater distances they must travel. One of the biggest barriers to access is social stigma surrounding the use of mental health services. Veterans may feel ashamed and embarrassed to seek treatment, but many times they're more likely to perceive mental illness as a sign of weakness due to the environment they've been exposed to. One solution to the problem that we're starting to see put into action is telehealth services. Studies have shown that telehealth-delivered psychotherapy results are comparable to those with traditional in-person treatment when it comes to treatment outcomes, therapeutic relationship, and retention. More recently, research has shown evidence-based psychotherapy to be well accepted by patients and cost-effective when provided using video telehealth. Clinical video teleconferencing, which allows for synchronous face-to-face communication between patient and provider, is one example of telemedicine that's become increasingly available in a wide variety of institutions and service systems. While this may require additional training in health technology and could heavily depend on a physician's time spent elsewhere, telehealth seems to be a great solution for veterans that either do not want to go out and be seen in public receiving these services due to stigma, or those who live in locations such as rural areas where it's difficult to find these services. In 2017, President Trump, with the help of the American Office of Innovation and the Secretary of Veterans Affairs, launched a mobile app that would make it easier to veterans to schedule appointments and talk to providers using their smartphones. Called Anywhere to Anywhere Healthcare, this initiative will allow veterans access to healthcare regardless of their geographic location. This is a huge step in bringing better, more cost-effective access to healthcare for veterans. I want to know, can you think of something like Trump's telehealth initiative that would be cost-effective and could help to improve access to care for veterans with mental health needs? And in terms of the severe shortage of mental health providers, what is one way you can think of to combat this shortage? Explain how we should go about increasing the number of mental health providers for the whole population, including veterans.